I'll be presenting on the live experiences. I'll just make it big so that everybody can see properly. Yes, I'm Dr. Victoria Hanson, and I thank the organizers of this program for inviting me to present my study. I do not take it for granted, and I hope this as a follow-up, because we're talking about mother and child now. So when we have preterm babies, what do we do? Now, this is just a diagram of a preterm baby admitted to tell us how much of problems, physical and psychological, that they normally have, and also the psychological effect of keeping their babies in NICU or mothers. I do not have anything to disclose. There's no affiliation or association with any organization, and the program was self-funded. The study was self-funded. As a form of introduction, approximately 15 million preterm babies are born worldwide every year. 60% of them are born in Africa and South Asia, and this is according to Perry. Several maternal factors play a role in placing a woman at risk of delivering a preterm, including maternal diabetes, hypertension, increased maternal age, obstetric practices such as cesarean section, and some other things, according to World Health Organization. Babies that are born are prone to complications and need medical intervention and special care in the NICU due to their compromised physiological states as a result of underdeveloped organs. The parents encounter traumatic experience due to the condition of the baby, the treatment, and non-attachment process that is always affecting or occupying their thoughts and their state of mind. A mother's expectation and excitement of having a healthy newborn is cut short when a baby is born premature. She's faced with the fear and anxiety of losing her baby, or overwhelming thoughts of her baby suffering inconceivable distress in the NICU. The study explored the life experience of mothers who had a preterm baby admitted in NICU. The methodology, the research approach was a qualitative and phenomenological approach. The participants were mothers of the preterm babies admitted in NICU, and the data collection was an in-depth face-to-face interview with mothers. Interviews were recorded after taking consent and permission from the mothers. Number of participants were 11, and the duration was from October 2019 to January 2022. Ethical approval was obtained from the university and the hospital setting where the research was conducted. Verbal consent was obtained from the mother for participation and for them to be audiotaped. And the recorded data were kept in the custody of the principal investigator. The instrument used was a semi-structured, open-ended questions, which were formulated, and mothers were encouraged to speak about their experience. It was an open-ended questions. This is the instrument that was used. The interview started with general demographic questions, followed by semi-structured interview guide to allow mothers to describe their experiences from the birth of the preterm baby, beginning from to the admission in the NICU. During the interview, mothers were asked to narrate what it felt like to have their babies born before term and be admitted to a highly intensive critical environment as the NICU. Prompts were used to elicit more information. The question guide is shown in the next slide. These are the questions. Did you have any premature baby before? How did you feel when you learned your baby is admitted in NICU? What was your experience when you first visited your baby in the NICU? What was the feeling of your family and spouse on baby's admission? What was your expectation of the healthcare team in caring for your neonates, especially nurses? What was your feelings on the condition of your neonates in the NICU? And how do you feel on the care being given to your baby by the healthcare team? The data was analyzed using the collapsing method, according to Mororuge 2015. The data was analyzed by using the steps described by this method, which is familiarization, identifying significant statements, formulating meanings, clustering themes, and developing an exhaustive description. Members from the research team individually and collectively read the verbatim transcript of the mothers. Significant statements relating to the phenomenon were extracted from each mother's transcript. Team members met to review significant statements. What was the rigor? Accuracy of finding was achieved through prolonged engagement till saturation was gotten. Meanings were formulated from the statements, and the teams were arranged to create a rich and exhaustive description of the mother's life experience. Following these, subteams and teams were generated. The result: the social demographic characteristics of mothers. There are 11 mothers. Majority of the mothers, 90%, were young adults. More than 50% were multipara, and 72% gave birth to preterm babies via normal delivery. Age of neonates, majority were between 28 to 36 weeks of gestation, and 70% of babies had their birth weight less than 2.5 kilograms. The themes that emerged were three. One, mother's expression of emotions with the preterm baby in the NICU. The second theme was families' experienced emotion, hope, and support on their baby's admission to the neonatal intensive care units. The mother's feeling of satisfaction related to the care provided by the nurses and the progress observed in the health of their babies. Looking at the first theme, the feeling of the mothers were that of being scared, being angry, and being sorry. These are negative emotions that were experienced when they realized that their baby is in need of special care and will be separated from them. I'm going to read out some of their comments. One mother said, "I was scared." Another said, "I felt hungry." Another one said, "I felt very sorry." Feeling angry is a secondary emotion, which basically can arise from the experience of loss, disappointment, anxiety, and worry. In the present study, it was due to unexpected birth of a baby who needs separation and hospitalization. Feeling scared is an indication that the individual has perceived some danger. Participants of the present studies were scared, maybe due to the perception of threats to their babies' lives. Another one is feeling scared was also prominent among the participants when they saw their baby for the first time in NICU, where the baby was surrounded with machines, tubes in the mouth, the nose, and other gadgets. One mother said, "Honestly, I was scared. They were too small and were connected to a machine." Another participant said, "I cried. My heart was broken. But alhamdulillah, I had to stay with him every day and breastfeed every 2 hours." Expression of positive emotion and trust on supreme power. Though majority of participants were feeling bad, sorry, and scared, one participant said, "It is totally different from the mother who gives birth in due time. Yet I am happy that I can see them, twins. In fact, faith in God brought comfort and cheer, even in the midst of this distress and crushing difficulties, which was observed in most of the participants. One of the participants said, I was little nervous and worried about what can happen. What can go wrong with my baby? But at the same time, Alhamdulillah, if Allah gives me this baby, He will take care of my baby. This is a feeling or an expression of a positive emotion. Feeling expression of hope. Hope is considered as a positive emotion in which individual envisions the brighter future for self or for loved one. It was evident from the feelings stated by participants when they were asked to express their feeling about the condition of their neonates. Most of the mothers were happy as their babies were improving. A mother said, much better than before. Now the baby is crying and opening eyes. As well, I can now breastfeed. I hope baby will get better soon as possible, and then we can go home. A very expression of hope. Another mother said, my feeling, it goes up and down. Sometimes when I get to know his news that he's not gaining weight, or that there's something wrong with his blood, or that again he's not breathing, it goes down. My feeling goes down, my breathing goes down. But again, alhamdulillah, something good is happening with the care of the nurses and the doctors. The second team family experienced emotion while their babies were in NICU. Hospitalization of a newborn to NICU not only leads to overwhelming emotional reaction from the mother, but the whole family, which was evident from these responses. Feeling of psychological shock, which can be triggered due to occurrence of unexpected events in human beings. Participants shared reaction of their family members towards the birth of their babies and the need for hospitalization in NICU. One participant said, for the family of one baby, the mother said, though they were aware of premature delivery, but not expecting that the condition of the baby would be so critical. Another one said, family support and love is unexplainable. Expression of unhappiness and fear of death. It is a natural expectation that baby will go home along with mother after delivery. She gave birth to a baby after 15 years of infertility. Family members were disappointed upon knowing that the baby is in NICU for special care. Similar response was also expressed by another family member. They were happy that I have a baby, but unhappy that the baby is not with me. The family support plays an important role in the outcome of the baby and the care of the baby and relieving stress of mother. Overall, all family members were very supportive. One participant said, they all supported me from all sides. They also made what they call dua, which is prayer for me. Though this was not expected to happen, they wish that it should not happen during the next baby. They gave me all their support and they were all happy that at least the baby is safe. The third perception was the care from the health care professionals. Families express satisfaction with the care provided, though there is a great challenge that is imposed on healthcare professionals to maintain the balance and harmony with mothers and ensuring quality of care for the baby and the psychological health of the family members. Participants' impression about the care by nurses working in NICU shows that of great satisfaction that was expressed by all the participants. The healthcare team, especially the nurses, are taking good care of my baby. The care is excellent and good, so says am a participant. Another one said, the expectation was really average. I thought it would be all taken care of by machine, but I was happy that it was a 24 hours care by nurses and doctors. They were always available, so I was really happy with that. And the machines are really advanced. There is always an alarm if something goes wrong, and the nurses were very caring. That was the feeling of one of the mothers. Family expressed good interpersonal relationship with the nurses as an educator. Nurses working in NICU play an important role in preparing the baby for discharge from day one. And they were involving the mothers in the care of the baby, simple procedures like diaper changing. The discussions from the study is basically on these three areas. The mothers worry about survival of their babies and generally challenged about care their preterm babies are receiving. Then family and spousal support. And then the third one is families, mother satisfaction with the health workers' care, communication, and permission to be part of the care. All these were discussed in the study as it relates to other studies that were done before, according to those that are mentioned there in 2017, 2015, 2020, and in 2017. What is the conclusion? Commonly cited maternal emotions include shock, feeling of unpreparedness, fear, anxiety, guilt that led to the development of 3 recommendations for clinical practice. NICU is not conducive to the formation of mother-child bonding, but a healthy bonding can nevertheless be accomplished with the help of dedicated nursing staff who commits to altering standard NICU nursing practice to consider mother's emotion. They provide physical and emotional frontline support to both mothers and baby and provide crucial informational resources for relationship development. However, it was appreciating to note the strong support from the family members and the healthcare professionals towards their well-being. What is the implication for practice? The strength of this study is that nurses' role is significant in providing appropriate care for the preterm infant. They also assisted mothers through this stressful, challenging experience by providing emotional support, trusting relationship, and accurate information. Then there should be development of universal practices to minimize the negative experience of the mother. We should initiate this and jumpstart the formation of a loving mother-child bond, even in NICU. Family-centered approach should also be adopted by all medical professionals in NICU setting. That is involving the doctor, the social skill workers, the midwives, the parents. All these are very important to get a very successful and eventful, non-eventful prognosis. NICU staff should participate in regular interdepartmental dialogue so that they can share their experience, and then more studies should be done. Future qualitative research should explore continued development of supportive care in NICU. What is our take-home message? Is that nurses play a significant role in providing appropriate care for preterm infants to prevent neonatal morbidity and mortality and postnatal stress and disorder. There is also a need for education, early identification and prompt treatment of high-risk pregnancies, and social support system to augment the hospital-based care for mothers and their preterm babies. I want to appreciate my co-authors, Dr. Sneha Patra, Ms. Sally, and Ms. Istra, and also the participating mothers. These are my references. Thank you.